Hi, Pam. Thanks for coming on our show. I'm very excited to have you on here today.
Yes, I'm excited to be here too, Taruna.
Yeah, a lot of people might not know Pam or Dr. Pamela Shields. She's going to be joining our practice starting September. She has a diploma in the McKinsey method, which is one of the very few clinicians across the country. And she's also a board certified orthopedic specialist, which is also one of the very few clinicians in the area who have gone through that extensive training. Plus, she brings in years of experience to our practice. So we are excited to talk to you a little bit more and dive into all that stuff.
Sure, happy to.
Yeah, so why don't you start by telling us a little bit about yourself?
Sure, yeah. So my family and I, we moved here to this Northern Virginia area in Herndon about 2 years ago. My husband, he's a colonel in the Air Force. So our life has been a lot of moving around and experiencing different regions of the United States and that sort of thing. So, but happy to actually, this is our second assignment here in Virginia. We're really happy to return here. We have 3 children. They love it here in Virginia. We like the seasons in Virginia. Our last station was in San Antonio, Texas. So even though it's been a hot summer in Virginia, it's still very refreshing. Happy to be here again.
No, it's great to have you here too. So why don't you tell us a little bit about your years of experience and your career as a physical therapist so far, practicing in different regions of the country?
Yeah, sure. So I've been a practicing physical therapist for 28 years, a long time.
Yeah, you've seen it all, the ups and downs, the highs and lows.
Exactly. It certainly has changed a lot in that time frame, but have managed to make quite a fun run of it so far. And also that experience of, again, our military lifestyle of moving around has really afforded me a wonderful and varied experience, not just with different patients and regions of the United States, but also in different practice settings, whether that's in the private practice, if it's in, a telehealth situation, if it's in a university system or a large health system or teaching hospital. And all of those things have just brought just a wealth of experience and improved my knowledge and understanding of not just musculoskeletal conditions, but people. So that I found to be just, invaluable.
Yeah. No, I can imagine having practiced for so many years and also in different areas, different settings. I'm sure you bring in little tidbits from everywhere.
Right.
And we'll have a lot to share with our patients. So what kind of motivated or inspired you to join or choose our practice over so many others in Northern Virginia?
Right. So, well, firstly, because it's with you, Taruna. But
yeah,
that's exciting. Yeah. Yes. It's although as a McKinsey method practitioner, and you go through all of that training and schooling and, knowledge building and those kinds of things, but there's still so much to learn from the patient's experiences and just practicing in general. And the thing that accelerates that is just working with another MDT practitioner. It accelerates that. And that is not just great for the practitioner, you enjoy your job and your work and who you're working with, but also what that does for those patients and clients that are coming to see you. They really benefit from that type of collaboration amongst those practitioners that are working together.
Yeah, no,
so
I'm looking forward.
I think this will be wonderful.
Yeah, the collaboration of the MDT clinicians, I'm looking forward to it because, like you said, it wasn't something that was available in this area when we started. There were hardly any MDT diplomat clinicians in the area. Now they are slowly growing in number, but to have that collaboration is going to be really nice. So what would you say is your vision, for your patients being a holistic provider in our practice?
Yeah. So I think something that probably is different there at your practice compared to kind of traditional practices is that many times the goal in a traditional practice is to achieve previous level of function. Just get back to where you were. You have an injury or an incident, and I just want to get back to where I was. But you can really do much more than that if that is the desire of the patient. So sometimes that patient would be like, yes, it's lovely. I can walk without pain now, but hey, is it safe for me to return to running or to another activity or to my yoga class? And sometimes in those traditional kind of practices, it just kind of stops there. And I feel that, there's so much more that can be offered, especially if that's what the patient would like to do. It's, that maintaining of the gains that have been made, or, helping and guiding in that way, or helping them not just achieve what they did before, but increase their capacity in general. So I kind of look forward to doing that, exploring that with patients who have that interest.
Yeah, no, it's all about giving people the choice. I think in traditional healthcare, we were losing the choice component. I mean, they got what they got. But yeah, what we really like is giving them the choice to go as far as they can. And they sometimes find out that, sky's the limit.
Right.
So yes, speaking of yoga, I know you have a little bit of experience and background with that. So what are some of the common yoga injuries that you see in people with back problems?
Yeah. So, it's even happened to me before.
Yeah.
It's like, sometimes I think yoga and back and leg pain sometimes go together.
Yeah, they almost go hand in hand. Yeah.
Yeah, it's going to happen. It's not if, it's when, right? So, but yes, so that, and I think recently that has been something that many of my patients have wanted to return to or aspire to do in the future. Like it's something they want to do for fitness, but either they had an injury before, or they're having recurring injuries, or they're like, they get better and then they go back into their yoga class or their yoga practice only to get re-injured again. And some of it is about just how traditional yoga class is put together. And it is common for like vinyasa yoga, flow yoga, to have lots of forward bends, lots of downward dog movements, lots of bending forward. And for most people, that is going to be an irritating movement, especially if they're in an episode of back pain or they have issues of, frequent recurrence of back pain and leg pain. And there's like a right time to come back to that and a not so good time to come back to that. But there's also other movements in yoga that are really helpful for people who have back and leg pain. And it's the opposite direction, but sometimes isn't found in the class setting just because traditional classes put things together in a different order. But that doesn't mean that you can't practice it differently and use those poses that would be, more beneficial for you. And, help you return to practicing yoga or trying yoga without fear of causing re-injury.
Yeah, no, I love it. A lot of our patients, like you said, they either come to us because they've injured themselves at a yoga class or are struggling to go back to yoga and then eventually give up on it completely. So it'll be great to have your guidance and your expertise in helping them gradually transition to such a beautiful way of staying active while not making their back or spine problem worse. So I know it's never one size fits all and every person is different, but if you had to share one or two quick tips for someone who's listening who has an achy back here and there and is also trying to do a couple yoga classes in a week, what would you suggest to them?
Right. If they seem to be most interested in those vinyasa type classes, with those that have lots of forward bends and downward facing dogs, sometimes just substituting with something else during the class flow can be helpful. So things like, okay, instead of doing downward facing dog, maybe doing a high plank or a forearm plank or going to a tabletop pose, table pose can be very helpful, that you can avoid those more deeper flexion movements. Or if the place that you have your yoga class, or if you do something virtual, maybe look towards the hatha yoga style, where the mountain pose is kind of the foundational pose, standing and posture, or substituting some of those other traditional poses with more of those posture poses or stamina poses like warrior poses and things like that, and focusing on something different, in your practice that time, that for a week or so. It's like maybe it's about balance instead. So there's lots of variations, but consider sometimes you have to avoid or decrease the amount of bending when you're going through an episode.
Yeah. No, that makes perfect sense. And I love the idea of substituting it with the right movements, at least for the short time, so they can still stay in the practice and not hurt or make their back problem worse.
Right. Yeah. And it can be sometimes very common for that. Although the yoga instructor is trained, they're not trained as MDTs. And so they don't know what directional preference is. But having a therapist who knows what that is and knows a little bit about yoga can be a pretty good combination.
Yeah, I agree 100%. I think having that combination would be irreplaceable, especially for people with back problems who are trying to use yoga as a tool to get back to activity. I think that was great. Any other last tips or last words for our practice, for our listeners before we end this episode?
Just really looking forward to it. Excited to work with you and your patients, and we're going to be doubling our MDT power. So
I'm looking forward to that too. Doubling our MDT power. So our appointments with Pam or Dr. Pamela Shields are going to be available soon, starting September. So if you would like to reserve your limited spots, feel free to reach out to us.
Looking forward to it.